Welcome. This is your ultimate 24-hour NCLEX review, covering the 50 highest yield topics that are most likely to appear on exam day. Stay focused, think critically, and test your clinical judgment with every question. Let's maximize your final review and boost your confidence before the NCLEX.
A 68-year-old client with a history of hypertension and atrial fibrillation is admitted with sudden right-sided weakness, slurred speech, and facial drooping. The nurse notes the client is alert, with BP 190/100 mmHg and glucose 110 mg per deciliter. Which intervention should the nurse anticipate as the priority? A. Administer aspirin immediately. B. Prepare for thrombolytic therapy. C. Lower blood pressure rapidly with 4 antihypertensives. D. Obtain a stat CT scan of the head. Answer, D. Obtain a stat CT scan of the head. Rationale: rapid imaging is required to differentiate ischemic from hemorrhagic stroke before any treatment. Question 2. A nurse is caring for a post-op client who suddenly becomes dyspneic, tachycardic, and anxious with oxygen saturation dropping to 86% on room air. The client reports sharp chest pain worsening with inspiration. What is the nurse's first action? A. Administer morphine. B. Elevate the head of bed and apply oxygen. C. Prepare for CT angiography. D. Encourage deep breathing exercises. Answer, B. Elevate the head of bed and apply oxygen. Rationale: immediate oxygenation and positioning are priority to support airway and breathing in suspected pulmonary embolism. Question 3. A client with diabetic ketoacidosis, DKA, presents with deep, rapid respirations, blood glucose of 520 mg per deciliter, and potassium level of 5.8 milliequivalent/L. Which physician order should the nurse question? A. Initiate 4 regular insulin infusion. B. Start 4 normal saline bolus. C. Administer potassium chloride 4. D. Monitor blood glucose hourly. Answer, C. Administer potassium chloride 4. Rationale: potassium is already elevated, insulin and fluids are priorities, but potassium replacement must be delayed. Question 4. A client receiving morphine for postoperative pain develops respiratory rate of 6 breaths/min and is unresponsive to stimuli. What medication should the nurse prepare to administer? A. Atropine. B. Naloxone. C. Flumazenol. D. Epinephrine. Answer, B. Naloxone. Rationale: naloxone reverses opioid-induced respiratory depression. Question 5. A nurse is caring for a client with acute heart failure presenting with crackles, dyspnea, and oxygen saturation of 88%. Which medication will the nurse anticipate administering first? A. Furosemide. B. Digoxin. C. Lisinopril. D. Metoprolol. Answer, A. Furosemide. Rationale: loop diuretics reduce fluid overload and pulmonary congestion rapidly. Question 6. A client is receiving heparin infusion for deep vein thrombosis. Which laboratory value indicates therapeutic effect? A. 1 Indian rupee. B. APTT 1.5 to 2.5 times control. C. Platelets 150,000/mm superscript 3. D. PT 12 seconds. Answer, B. APTT 1.5 to 2.5 times control. Rationale: APTT is used to monitor heparin therapy effectiveness. Question 7. A nurse notes that a client with increased intracranial pressure, ICP, has a Cushing's triad. Which findings confirm this condition? A. Tachycardia, hypotension, and tachypnea. B. Bradycardia, widened pulse pressure, and irregular respirations. C. Hypertension, tachycardia, and fever. D. Hypotension, bradypnea, and bradycardia. Answer, B. Bradycardia, widened pulse pressure, and irregular respirations. Rationale. Cushing's triad is a late sign of increased ICP indicating brain herniation risk. Question 8. A client with chronic kidney disease, CKD, has potassium level of 6.5 milliequivalent/L. What is the nurse's priority action? A. Administer sodium polystyrene sulfonate. B. Place the client on a low-protein diet. C. Administer 4-calcium gluconate. D. Restrict fluids. Answer: C. Administer 4-calcium gluconate. Rationale: calcium stabilizes cardiac membranes to prevent lethal dysrhythmias in hyperkalemia. Question 9. A nurse is caring for a client receiving total parenteral nutrition, TPN. Which complication requires immediate intervention? A. Blood glucose 180 mg per deciliter. B. Cloudy solution in 4 tubing. C. Temperature 37.2 degrees Celsius. D. Urine output 40 milliliters per hour. Answer: B. Cloudy solution in 4 tubing. Rationale: cloudy TPN suggests contamination and risk of sepsis. The infusion must be stopped. Question 10. A client receiving chemotherapy reports mouth sores and difficulty swallowing. Which intervention is most appropriate? A. Encourage spicy foods to stimulate appetite. B. Provide alcohol-based mouthwash. C. Offer soft, bland foods and saline rinses. D. Restrict oral care to prevent irritation. Answer: C. Offer soft, bland foods and saline rinses. Rationale: mucositis requires gentle oral care and non-irritating foods. Question 11. A 74-year-old client with pneumonia is admitted with confusion, fever of 39 degrees Celsius, tachycardia, and hypotension. The nurse notes elevated lactate levels. Which condition is the client most likely experiencing? A. Hypovolemic shock. B. Septic shock. C. Cardiogenic shock. D. Neurogenic shock. Answer: B. Septic shock. Rationale: infection with systemic inflammatory response, hypotension, and elevated lactate indicate septic shock. Question 12. A client with a history of chronic obstructive pulmonary disease, COPD, is receiving oxygen at 6 liters per minute via nasal cannula. The nurse observes increasing somnolence and decreased respiratory drive. What is the priority nursing action? A. Increase oxygen flow to 8 liters per minute. B. Encourage deep breathing exercises. C. Reduce oxygen flow to 2 liters per minute. D. Administer bronchodilator immediately. Answer: C. Reduce oxygen flow to 2 liters per minute. Rationale: COPD patients rely on hypoxic drive. Excessive oxygen can suppress respiration. Question 13. A nurse is caring for a client receiving a blood transfusion who develops fever, chills, and back pain within 15 minutes. What is the nurse's first action? A. Slow the transfusion rate. B. Notify the provider. C. Stop the transfusion immediately. D. Administer acetaminophen. Answer: C. Stop the transfusion immediately. Rationale: these are signs of a hemolytic transfusion reaction. Transfusion must be stopped immediately. Question 14. A postoperative client is prescribed enoxaparin for DVT prophylaxis. What is the appropriate nursing intervention? A. Massage injection site after administration. B. Administer in the abdomen and avoid aspiration. C. Aspirate before injection. D. Inject into muscle tissue. Answer: B. Administer in the abdomen and avoid aspiration. Rationale: enoxaparin is given subcutaneously in the abdomen without aspiration to reduce tissue trauma. Question 15. A client with hyperthyroidism is admitted with fever, tachycardia, agitation, and tremors. Which condition is the nurse most concerned about? A. hypothyroidism. B. Thyroid storm. C. Addison's disease. D. Myxedema coma. Answer: B. Thyroid storm. Rationale: thyroid storm is a life-threatening exacerbation of hyperthyroidism requiring emergency intervention. Question 16. A nurse is caring for a client with hypoglycemia presenting with diaphoresis, confusion, and trembling. What is the best immediate intervention if the client is conscious? A. Administer 4 insulin. B. Give 15 g of fast-acting carbohydrate. C. Initiate 4 dextrose. D. Encourage fluid restriction. Answer: B. Give 15 g of fast-acting carbohydrate. Rationale: oral glucose is the first-line treatment for conscious patients with hypoglycemia. Question 17. A client with acute pancreatitis has severe abdominal pain, elevated amylase, and lipase levels. Which intervention is the priority? A. Encourage oral intake. B. Administer pancreatic enzymes. C. Keep the client NPO. D. Administer high-fat diet. Answer: C. Keep the client NPO. Rationale: resting the pancreas is essential to reduce enzyme secretion and inflammation. Question 18. A nurse assesses a client with a chest tube who suddenly develops subcutaneous emphysema and absent drainage. What is the nurse's priority action? A. Clamp the chest tube. B. Notify the provider immediately. C. Strip the tubing. D. Increase suction pressure. Answer: B. Notify the provider immediately. Rationale: subcutaneous emphysema indicates air leak or system malfunction requiring urgent evaluation. Question 19. A client receiving furosemide reports muscle weakness and palpitations. Which lab value is most concerning? A. Sodium 140 milliequivalent/L. B. Potassium 2.8 milliequivalent/L. C. Calcium 9.0 milligrams per deciliter. D. Chloride 100 milliequivalent/L. Answer: B. Potassium 2.8 milliequivalent/L. Rationale: hypokalemia is a common side effect of loop diuretics and can cause life-threatening arrhythmias. Question 20. A nurse is preparing to discharge a client after hip replacement surgery. Which instruction is most important? A. Cross legs when sitting. B. Avoid hip flexion beyond 90 degrees. C. Bend at the waist when picking objects. D. Sleep on the affected side. Answer: B. Avoid hip flexion beyond 90 degrees. Rationale: preventing hip dislocation is the priority after hip replacement. Question 21. A client with a history of atrial fibrillation is prescribed warfarin therapy. The nurse reviews laboratory results and notes an INR of 5.2. Which action should the nurse anticipate? A. Administer vitamin K. B. Increase warfarin dose. C. Continue current therapy. D. Administer protamine sulfate. Answer: A. Administer vitamin K. Rationale: an elevated INR indicates excessive anticoagulation. Vitamin K is the antidote for warfarin. Question 22. A nurse is caring for a client with acute myocardial infarction who suddenly develops ventricular fibrillation on the cardiac monitor. What is the nurse's priority action? A. Administer epinephrine. B. Perform defibrillation. C. Start chest compressions. D. Administer amiodarone. Answer: B. Perform defibrillation. Rationale: ventricular fibrillation is a shockable rhythm. Immediate defibrillation is required. Question 23. A client with liver cirrhosis presents with ascites, jaundice, and confusion. Which laboratory value is most indicative of hepatic dysfunction? A. Elevated creatinine. B. Elevated bilirubin. C. Elevated hemoglobin. D. Elevated sodium. Answer: B. Elevated bilirubin. Rationale: increased bilirubin reflects impaired liver function and bile metabolism. Question 24. A nurse is caring for a client receiving magnesium sulfate for preeclampsia. Which finding indicates magnesium toxicity? A. Increased reflexes. B. Respiratory rate of 10 per minute. C. Hypertension. D. Hyperactive bowel sounds. Answer: B. Respiratory rate of 10 per minute. Rationale: magnesium toxicity causes respiratory depression and loss of reflexes. Question 25. A client with asthma presents with wheezing, dyspnea, and use of accessory muscles. Which medication should the nurse administer first? A. Inhaled corticosteroid. B. Short-acting beta agonist. C. Leukotriene modifier. D. Antihistamine. Answer: B. Short-acting beta agonist. Rationale: short-acting bronchodilators, e.g., albuterol, provide rapid relief of bronchoconstriction. Question 26. A nurse is assessing a client with suspected appendicitis. Which finding is most concerning and requires immediate surgical intervention? A. Rebound tenderness. B. Mild nausea. C. Low-grade fever. D. Constipation. Answer: rebound tenderness. Rationale: rebound tenderness indicates peritoneal irritation, suggesting possible rupture. Question 27. A client receiving lithium therapy reports tremors, diarrhea, and vomiting. What is the nurse's priority action? A. Encourage fluid restriction. B. Hold lithium and notify provider. C. Administer the next dose as scheduled. D. Provide a high-sodium diet. Answer: B. Hold lithium and notify provider. Rationale: these are signs of lithium toxicity, requiring immediate discontinuation. Question 28. A nurse is caring for a client with a pneumothorax who has a chest tube. Which finding indicates the system is functioning properly? A. Continuous bubbling in the water seal chamber. B. Fluctuation, tidling, in the water seal chamber. C. Absence of drainage in the collection chamber. D. Increased suction chamber bubbling. Answer: B. Fluctuation, tidling, in the water seal chamber. Rationale: tidling indicates the chest tube is patent and functioning correctly. Question 29. A client with Addison's disease presents with fatigue, hypotension, and hyperkalemia. Which intervention is priority? A. Administer corticosteroids. B. Restrict sodium intake. C. Encourage diuretics. D. Provide insulin therapy. Answer: A. Administer corticosteroids. Rationale: Addison's disease involves adrenal insufficiency, steroids are life-saving. Question 30. A nurse is caring for a client with a burn injury covering 30% of total body surface area. Which complication is the client most at risk for in the early phase? A. Infection. B. Hypovolemic shock. C. Hyperkalemia. D. Hypertension. Answer: B. Hypovolemic shock. Rationale: fluid loss from burns leads to hypovolemia and shock in the early phase. Question 31. A nurse is caring for a client diagnosed with active tuberculosis who is coughing and producing sputum. Which infection control measure is the priority? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions only. Answer: C. Airborne precautions. Rationale: tuberculosis is transmitted via airborne particles, requiring a negative pressure room and N95 mask. Question 32. A client with suspected meningitis presents with fever, headache, and neck stiffness. Which nursing intervention is the priority? A. Perform lumbar puncture. B. Initiate droplet precautions. C. Administer 4 antibiotics after cultures. D. Encourage fluid restriction. Answer: B. Initiate droplet precautions. Rationale: meningitis is transmitted via respiratory droplets. Isolation must be initiated immediately. Question 33. A nurse is monitoring a client receiving 4 potassium chloride. Which finding requires immediate intervention? A. Urine output 50 milliliters per hour. B. Serum potassium 4.0 milliequivalent/L. C. ECG showing peaked T waves. D. Blood pressure 120/80 mmHg. Answer: C. ECG showing peaked T waves. Rationale: peaked T waves indicate hyperkalemia, which can lead to life-threatening arrhythmias. Question 34. A client with head trauma is noted to have clear fluid leaking from the nose. What is the nurse's priority action? A. Apply pressure to the nose. B. Insert nasal packing. C. Test the fluid for glucose. D. Encourage the client to blow their nose. Answer: C. Test the fluid for glucose. Rationale: clear nasal drainage may indicate cerebrospinal fluid leak. Glucose testing helps confirm. Question 35. A nurse is caring for a client with anemia and hemoglobin level of 7.2 g/dl. Which symptom is expected? A. Hypertension. B. Fatigue and pallor. C. Bradycardia. D. Increased appetite. Answer: B. Fatigue and pallor. Rationale: low hemoglobin reduces oxygen delivery, causing fatigue and pallor. Question 36. A client with chronic heart failure is prescribed digoxin. Which finding indicates digoxin toxicity? A. Heart rate 78 bpm. B. Visual disturbances, yellow-green halos. C. Blood pressure 130/80 mmHg. D. Urine output 50 milliliters per hour. Answer: B. Visual disturbances, yellow-green halos. Rationale: visual changes are a classic sign of digoxin toxicity. Question 37. A nurse is caring for a client with a nasogastric NG tube connected to suction. Which finding indicates proper function? A. Continuous bubbling in suction chamber. B. Greenish drainage in collection container. C. No drainage in tubing. D. High-pitched bowel sounds. Answer: B. Greenish drainage in collection container. Rationale: gastric contents are typically greenish. This indicates proper NG placement and function. Question 38. A client is receiving thrombolytic therapy for acute ischemic stroke. Which complication should the nurse monitor for most closely? A. Hypertension. B. Bleeding. C. Hypoglycemia. D. Bradycardia. Answer: B. Bleeding. Rationale: thrombolytics increase the risk of hemorrhage and require close monitoring. Question 39. A nurse is caring for a client with BPH, benign prostatic hyperplasia, who reports urinary retention. Which medication is commonly prescribed? A. Tamsulosin. B. Furosemide. C. Insulin. D. Albuterol. Answer: A. Tamsulosin. Rationale: tamsulosin relaxes smooth muscle in the prostate and bladder neck, improving urine flow. Question 40. A client with schizophrenia is taking haloperidol and develops muscle rigidity, fever, and altered mental status. What condition is the client experiencing? A. Serotonin syndrome. B. Neuroleptic malignant syndrome. C. Anticholinergic toxicity. D. Extrapyramidal symptoms. Answer: B. Neuroleptic malignant syndrome. Rationale: NMS is a life-threatening reaction to antipsychotics characterized by rigidity, fever, and altered mental status. Question 41. A nurse is caring for a client with acute respiratory distress syndrome, ARDS, who is on mechanical ventilation. The client's oxygen saturation is 88% despite high oxygen settings. Which intervention is most appropriate? A. Lower the oxygen concentration. B. Increase tidal volume only. C. Apply positive end expiratory pressure, PEEP. D. Place the client in supine position. Answer: C. Apply positive end expiratory pressure, PEEP. Rationale: PEEP prevents alveolar collapse and improves oxygenation in ARDS. Question 42. A client with suspected ectopic pregnancy presents with abdominal pain and vaginal bleeding. Which finding requires immediate intervention? A. Positive pregnancy test. B. Shoulder pain and hypotension. C. Mild cramping. D. Slight spotting. Answer: B. Shoulder pain and hypotension. Rationale: shoulder pain and hypotension suggest internal bleeding and possible rupture, a medical emergency. Question 43. A nurse is caring for a client with a potassium level of 3.0 milliequivalent/L. Which ECG finding is expected? A. Peaked T waves. B. Flattened T waves and U waves. C. Wide QRS complex. D. ST elevation. Answer: B. Flattened T waves and U waves. Rationale: hypokalemia causes ECG changes including flattened T waves and prominent U waves. Question 44. A client with a history of seizures is experiencing a tonic-clonic seizure. What is the nurse's priority action? A. Insert a tongue blade. B. Restrain the client. C. Protect the client from injury. D. Administer oral medication. Answer: C. Protect the client from injury. Rationale: safety is the priority during a seizure, prevent injury and maintain airway. Question 45. A nurse is caring for a client with hypercalcemia. Which symptom is most consistent with this condition? A. Muscle twitching. B. Tetany. C. Weakness and lethargy. D. Hyperreflexia. Answer: C. Weakness and lethargy. Rationale: hypercalcemia leads to decreased neuromuscular excitability causing weakness and lethargy. Question 46. A client receiving continuous 4-insulin infusion for DKA has a blood glucose of 250 mg per deciliter. What is the nurse's next action? A. Stop insulin infusion. B. Add dextrose to 4 fluids. C. Increase insulin rate. D. Administer oral glucose. Answer: B. Add dextrose to 4 fluids. Rationale: when glucose reaches 250 mg/dl, dextrose is added to prevent hypoglycemia while continuing insulin. Question 47. A nurse is caring for a client post-thyroidectomy. Which assessment finding is most concerning? A. Hoarseness. B. Sore throat. C. Airway obstruction and stridor. D. Mild neck discomfort. Answer: C. Airway obstruction and stridor. Rationale: stridor indicates airway compromise and is a medical emergency after thyroid surgery. Question 48. A client with rheumatoid arthritis is prescribed methotrexate. Which instruction should the nurse include? A. Avoid alcohol consumption. B. Take with high calcium foods. C. Increase sun exposure. D. Take with NSAIDs only. Answer: A. Avoid alcohol consumption. Rationale: methotrexate is hepatotoxic, and alcohol increases liver damage risk. Question 49. A nurse is caring for a client with increased intracranial pressure. Which intervention should be avoided? A. Elevating the head of bed to 30 degrees. B. Clustering nursing care. C. Encouraging Valsalva maneuver. D. Maintaining neutral head alignment. Answer: C. Encouraging Valsalva maneuver. Rationale: Valsalva increases intracranial pressure and should be avoided. Question 50. A nurse is caring for a client with suspected compartment syndrome after a cast application. Which symptom is an early indication? A. Pallor and pulselessness. B. Paralysis. C. Severe pain unrelieved by medication. D. Cool, pale extremity with no sensation. Answer: C. Severe pain unrelieved by medication. Rationale: pain out of proportion to injury and unrelieved by analgesics is the earliest and most sensitive sign of compartment syndrome.
Great work completing this review. Keep practicing consistently. Review the rationales behind every question and strengthen any weak areas. If you found this session helpful, like, subscribe, and share it with someone preparing for the NCLEX. Wishing you success on your exam. You've got this.